Pitcairn, I was really interested to see that you are still moving forward to expand homeopathic medicine to our furry friends and family members. When did you, after graduating from University of California, when did you first decide to start looking, or what triggered you to begin looking at homeopathy for our pets?
Well, let me try to give you that as a short story.
Okay.
It took a few years, you can imagine. I graduated from veterinary school, University of California, Davis in California in 1965, and I went into practice in Southern California, and I'm giving this to you very briefly, but
sure.
That first couple of years I was in practice, I was disappointed because I did not see the results I expected to see from my training in school. In other words, I had, as a student, I had been led to believe, I don't know if I was led to believe, but I did believe that the treatments that were being given to me as appropriate to use would be highly successful.
So the animal outcomes you were getting was not what you had hoped for.
Not what I hoped for, and I came to the obvious conclusion, which was that it was my deficiency.
Oh, okay.
Right.
So when
it couldn't possibly be that medicine hadn't caught up. It would be that you didn't quite get the concepts.
I was a good student. I got good grades in school, but somehow I had missed some of it. So I had the chance, after a couple of years of practice, through a classmate connection, to take a job up at Washington State University in the state of Washington, the vet school there, which I did for a year. I took a job as an assistant professor, teaching and so on, with some research. And during that time, I studied virology. Part of the program was to be able to take some free credits. So I took virology, which I really enjoyed a great deal. I got A's in. I really found it fascinating. So after taking a year of that, and my term was coming to an end, I went to my professor and said, "I really enjoyed this. Is there anything else I could take along this line?" Thinking there'd be one next semester,
Right.
He said, "Well, I don't know. Let me think about it," which I thought was rather odd, that he didn't know.
Right.
Right.
But I went back to my cubicle and down in the other building, down at the vet school. And the next day or two, down comes the head of the microbiology department and says, "Well, you're in."
Wow.
I said, "In what?" He said, "Well, you have an NIH postdoctoral fellowship to go to graduate school." And I didn't even know I was applying for it.
Wow.
Life was a little simpler then.
Yeah.
Well, I think it was. So anyway, I went on to graduate school. I thought, this is a great opportunity, and I focused in immunology. And still, after studying all of this and finding it very fascinating, I still felt like I didn't understand how to restore health to animals.
And so at that time, you were using the traditional medicines which were available. Right now, for any of us who have pets, we're accustomed to having antibiotics. We actually just had our dog in this morning. She was a little ill this week, so she received an injection of some antibiotics. She has a topical for, we got a topical to clean out her ear. She has a mild ear infection, but other than that, we try to stay very minimal with interventions. We, sort of, but as soon as we see something that, she clearly was lethargic, we call the vet and get in, because you can't read their mind. They're not really good at communicating what's going on, and animals will often try to hide any of their symptoms, because in the pack, especially with dogs, that would be seen as a sign of weakness. So that's what I'm thinking. When you were practicing, you probably were relatively limited in what you were able to provide a pet who had signs of a flu or even arthritis or a digestive problem.
Well, like any study or practice, one becomes more experienced, and so what you say would be true probably at first, but as you work with animals, you learn to recognize the signs.
Wow.
It's not that much of a puzzle.
And that's what I really want our listeners to understand. Although you may not be seeing what seems to be abnormal behavior in your pet, the annual checkups for your pet are every much as important for them as it is for you to have an annual checkup with your doctor, because your veterinarian will see things that you just may become accustomed to as well. That's just the way your pet behaves, and there could be an underlying problem. So for all of us pet lovers out there, please make certain you get your pets in for at least an annual checkup. So, doctor, please.
I would modify that.
Okay.
I don't recommend annual checkups.
Really?
If you're going to a conventional veterinarian.
Ah.
Because they will vaccinate and they will come up with diagnoses that I would not agree with and do treatments.
Well, that's
I would go to a veterinarian that's doing an alternative practice, especially homeopathic or some other alternative practice. We'll look at your animal differently.
Well, that's one of the reasons our listeners might be wondering why we have a veterinarian on the show, and there's so much overlap because of the vaccinations, especially, as well as homeopathy. I think a new slant, if we could get our listeners to kind of look at this from another angle.